Hey guys, so kind of the first time I've really done a video like this, but I was talking to my dad the other day. He's an avid CrossFitter, and he is, hopefully I don't get this wrong, Dad, I think he's 59 years old. Great shape. Hope I can be in that type of shape when I'm his age. However, he's experienced some shoulder impingement issues, some just lower back pain, stuff that probably most people just assume comes from working out, especially at his age and how frequently that he does it. He's already had one rotator cuff surgery, but the biggest thing that he lacks is overhead mobility. And so I've kind of talked to him about it a few times, and I mean, I'm just really learning, but there's been some things that I've kind of realized recently on myself, on some of the athletes that I work with, that I believe are pretty effective that a lot of people tend to ignore. And that primarily is kind of thinking of our body as pillars. So what I mean by that is thinking from either the top down or from the bottom up. So for instance, if we're talking about our neck, an area that requires a lot of stability. If we talk about our upper back, an area that would require a lot of mobility. And if we talk about our lower back, we're talking about needing a lot of stability. Then we go down to our hips, again we're talking about more mobility. Down to our knees, we're talking about stability needed. And then all the way to our ankles, we're talking about mobility. So you can kind of see the pattern throughout your body requiring mobility in a certain joint and stability in another joint. Okay, when we talk about stability, we're not talking about a lack of movement or anything like that, but whereas, for instance, in your knees, okay, your knees are mobile, but especially moving medial and laterally, you need to have stability in that region. Kind of what we're focusing on a little bit here is examining more of the spine. So we talked about our neck and our upper back and our lower back essentially. Okay, when we refer to our spine, a lot of times people just think about your spine as a whole, not really thinking about what the different purposes of the different regions of your spine are. So we got our cervical spine, okay, that would be our neck region. We got our thoracic spine, okay, that's kind of our upper middle back. Then we got our lumbar spine, okay, our lower back, and then we talk more about our pelvic region, kind of with our sacrum and our coccyx. Another thing that kind of goes hand in hand with that again, I think a lot of professionals nowadays try to make more money and try to really just work on a certain area. When we're talking about kind of manipulating a joint, we're talking about myofascial release, soft tissue work. You're kind of focusing on the area that the pain is coming from, rather than thinking of the pain maybe as a symptom from pain in another area. So for instance, a lot of people have lower back pain, tight lower back, sore lower back. Okay, so we think about, okay, I need my lower back stretch, I need to crack my lower back, I need to strengthen my lower back. Whereas I'm kind of trying to introduce the thought that maybe our lower back pain is coming from our thoracic spine, okay? And tying from what I talked about in the beginning with my dad and his real lack of overhead mobility, we refer to our thoracic spine. So a lot of times of what happens today, you know, a lot of people are sitting in desk chairs, okay? You see a lot of rounded backs, okay? You see shoulders coming forward, you see slouched postures, okay? Some of that comes from so much of our society focusing on a lot of anterior movement with our pecs, with our biceps, okay, with our deltoids, and a lack of posterior movement. But that's kind of secondary to what I wanted to address. Sorry, again, like I said, I'm learning. I want to take a look at what I'm talking about, make sure I don't get too far off topic. But an immobile thoracic spine, okay, our upper back. So we think about our upper back, and a lot of times you don't think about getting much mobility forward and backward. It's more you think about your shoulders moving, okay, you think about your neck moving, you think about your hips and your lower back moving, but our upper back is left out a lot. Okay, I would be here to say that the reason for our shoulder impingement, our shoulder pain, is due to immobile thoracic spine, which causes a sick scapula or scapular dyskinesis. All right, so what I mean by that is the way our our shoulder blades or our scapula sit in our upper back, kind of on our rib cage. There's 4 movements that need to be able to occur within your shoulder blades. Okay, the first would be protraction. Okay, so if you're looking from the side, all right, you could kind of see my shoulder blades coming forward around into the upper back. That would be protract. Retract would be my shoulder blades coming back, okay? And then we would have elevation, my shoulder blades shrugging up, then we'd have depression with my shoulder blades depressing down. Okay, so there's 4 movements that would come from our scaps, and that requires good thoracic mobility. Okay, the primary muscles throughout our upper back, okay, that are going to be moving our scapula are actually attached to our clavicle and our glenohumeral joint of our shoulder, and that's what's actually going to be affecting our rotator cuff. So if you have a lack of mobility in your upper back, which causes a sick scapula, where you're not having good mobility or motion in one of those movements that I mentioned, then you're going to have shoulder impingement. Okay, so what I want to talk about and kind of show what we can do with that is a few thoracic spine exercises to mobilize that, and then a few kind of scapular exercises that we can use to prepare our shoulder joint for activity. So we talk about our thoracic spine. Kind of one of the first exercises that I like to do a lot, very basic, okay, is just to get good extension. All right, so what ideally you'd want to do is place a foam roller, okay, directly beneath where your shoulder blades are on your upper back. A good way to kind of find where that is crossing your arms in front of you. Kind of roll up right when you see where that shoulder blade is. You'll want to cross your hands behind your head. The goal here is to inhale, bringing your head and your shoulders back, trying to extend through that upper back. And then exhale as we come up, kind of letting those shoulders come forward, protracting those scapulas. Go ahead and get 5 of these. Getting good extension. From there, we don't want to think only of our thoracic spine as having, I guess, the movement of extension, but also the way that our kind of vertebral discs sit on top of each other is that they require some rotation as well. So what we want to think about is getting rotation through there. Another exercise that I like after we get our extensions on our foam roll is what we call the quadruped half windmill. So we're coming here, okay, one arm behind our head. The goal is to open our chest up, extending through our thoracic spine, and then bringing that shoulder forward, touching our elbow to our wrist. Then open up, focus on our breathing, bring that elbow to the wrist. Going to get 5 on your right side, and then 5 on your left side. Okay. The third thoracic spine exercise that I really enjoy is called the side lying windmill. So for here, we're going to go and come lying on our side. All right. The goal that I'll have here is I'll put a foam roller in between my legs or a medicine ball or something. The goal here is to keep our lower back in a neutral position. From there, we'll be lying on our side. If you notice, seeing my bottom hand, it is slightly in front of my top hand. What I'll do here, sliding my shoulder blade forward, bringing my top hand over the top of my bottom hand, and then I'll windmill up. Notice I'm not just throwing my shoulder back, I'm not just throwing my arm back, I'm getting that rotation through my upper back, and then I come back. Bring that upper hand forward, rotation through the upper back, and then come up. Go and get 5 on my left side, and then 5 on my right side. Okay, from there, we start to regain a little bit of more function in our thoracic spine, a little bit more mobility. Okay, moving side to side, moving forward. All right, you'll notice that you feel a lot looser just from there. Okay, but the goal also now is to be able to train our mind and our body to work with these adaptations. All right, to be able to move our scapula in an efficient way. So a couple exercises that I would like to do to kind of fix that sick scapula, as we like to call it, would be, sorry, make sure I got my exercises right. A couple exercises where we're going to get flexion through our shoulder, abduction through our external rotators, and then a little bit of protraction and retraction. Okay, so the first movement what we'll do here, all right, is back to wall, shoulder flexion. So go and put your feet about 6 inches away from the wall, all right? The goal here is to have your head, your shoulders, your lower back, and your hips all touching the wall, okay? It's gonna be tough to get into that position, but once you find that position, you're gonna have your hands to your side. Think about relaxing through your traps, relaxing through your shoulders. You're gonna bring your thumb straight up. As you come up, I want you to think about reaching your hands as far forward as possible, letting those scapulas slide towards the front of the rib cage. And as you do that, bringing the hands up, and then letting the scaps slowly slide back into place, as you bring the thumb to the wall. You can hold that for 2 seconds. You're going to slowly come down in the same manner. Notice again, as I come up, I reach my fingers forward, and then they kind of come back as I bring my hands to the wall. And then as I come down, so reach it forward, and then I bring my scaps back. You're going to get 5 up and down. We want to get that mobility through our scapulars, coming towards the front of the rib cage and coming back. Getting that protraction and retraction. Okay, a second exercise that I'd like to do is when we're on the wall, again, same position, trying to find a spot where we're keeping good posture, hips, lower back, shoulders, and head against the wall. You're going to bring one arm out to 90 degrees. The goal here is now we're going to get external rotation through our shoulder joint. What would be easy for us to do is to drive our elbow into the wall as we pull our arm back. That would defeat the purpose, however. If you're keeping the elbow against the wall, you're now driving your shoulder forward and working our anterior deltoids, kind of working into our pec minor. That's not our goal here. We want to work in our backside through our stabilizing muscles, our rhomboids and our teres minor. So as we do this, I want you to think about someone's pulling down on the back of your shoulder. You want to think about pulling the back of your shoulder straight into your armpit as you bring that hand up and then come back down. You'll notice my elbow will slightly come off the wall to keep good posture. I'll go for 5, and then I'll relax and I'll switch sides. I'll go for 5, pulling through the back part of my deltoid and coming down. Once you get 5 each side, again, just going through some effective warm-ups for our shoulders, we'll go ahead and get the same idea where we'll be in that same position on the wall for a third variation. Okay, once you keep in this position now, I want our hands directly in front of us. Like we talked about with our flexion coming up, I want you to reach your hands forward so your shoulders are rolling forward off the wall. From there, I want you to think about the way your scapulas are sitting, pulling them down, pulling your scapulas down towards your hips, down through your armpits as you open your arms up. Coming out and back in. Notice, I don't need us coming in a straight line. We're not trying to bring our shoulder blades straight back, but rather trying to bring them down as we come back. Okay, that's the depression movement we talked about. Okay, as we go a few of these exercises, okay, I want you guys to kind of get the idea that this is more anatomical adaptation. Okay, this isn't necessarily exercises that are going to strengthen your upper back, exercises that are going to strengthen your shoulder joint, gonna strengthen your rhomboids, the muscles that hold your scapulas in place, but rather trying to break motor patterns that have been ingrained in our head for so long and help us to kind of open up our chest a little bit, open up our upper back a little bit. I think that's pretty much all I wanted to cover for today. Again, I'm kind of using this as a learning tool for myself, but also trying to really mainly help out my dad with a little bit of his overhead mobility, and hopefully, this might be something that anyone else would be interested in. Thanks.